Question 1. What is the best method to prevent ventilator-associated pneumonia, VAP? A. Administer antibiotics routinely. B. Elevate the head of the bed 30 to 45 degrees. C. Change ventilator tubing daily. D. Perform deep suctioning every hour. Answer. B. Elevate the head of the bed 30 to 45 degrees. Question 2. What is the primary purpose of surgical hand antisepsis? A. To eliminate all microorganisms. B. To reduce transient and resident flora. C. To sterilize the skin. D. To reduce glove perforations. Answer. B. To reduce transient and resident flora. Question 3. When caring for a patient with open tuberculosis, the nurse must prioritize which precaution? A. Protective isolation. B. Contact precautions. C. Airborne precautions. D. Reverse precautions. Answer. C. Airborne precautions. Question 4. What is the correct response to a patient requesting fresh flowers in a neutropenic room? A. Allow them if watered daily. B. Place them away from the patient. C. Explain that fresh flowers are not permitted. D. Allow them with a plastic cover. Answer. C. Explain that fresh flowers are not permitted. Question 5. A client is receiving chemotherapy. Which food should the nurse recommend avoiding to reduce infection risk? A. Pasteurized milk. B. Fresh strawberries. C. Canned green beans. D. Cooked chicken. Answer. B. Fresh strawberries. Question 6. What is the most effective way to interrupt the chain of infection? A. Administer prophylactic antibiotics. B. Perform routine disinfection. C. Practice effective hand hygiene. D. Use gloves for every patient. Answer. C. Practice effective hand hygiene. Question 7. When should a nurse remove gloves when performing multiple tasks for one patient? A. After touching non-intact skin. B. After leaving the room. C. After adjusting bed linens. D. After using the telephone. Answer. A. After touching non-intact skin. Question 8. What is the first step in cleaning a contaminated surface? A. Wipe with alcohol. B. Wash with soap and water. C. Spray with disinfectant. D. Cover with a barrier. Answer. B. Wash with soap and water. Question 9. When performing oral care for an unconscious patient, what PPE is required? A. Gloves only. B. Gloves and mask. C. Gloves, gown, and mask with face shield. D. No PPE is needed. Answer. C. Gloves, gown, and mask with face shield. Question 10. A nurse enters a room of a patient with droplet precautions. What is the priority action before exiting? A. Remove gloves first. B. Perform hand hygiene. C. Remove mask after exiting the room. D. Don new gloves. Answer. B. Perform hand hygiene. Question 11. A staff member reports a needle stick injury. What is the nurse's immediate action? A. Call the infection control nurse. B. Wash the area with soap and water. C. Fill out an incident report. D. Notify the unit manager. Answer. B. Wash the area with soap and water. Question 12. For which patient should the nurse implement contact precautions? A. Meningococcal meningitis. B. Varicella. C. RSV, respiratory syncytial virus. D. Measles. Answer. C. RSV, respiratory syncytial virus. Question 13. Which nursing action reduces the risk of surgical site infection? A. Wearing 2 pairs of sterile gloves. B. Administering prophylactic antibiotics preoperatively. C. Applying chlorhexidine ointment post-op. D. Using adhesive dressings only. Answer. B. Administering prophylactic antibiotics preoperatively. Question 14. What is the nurse's priority action when a dressing change reveals signs of wound infection? A. Apply an antimicrobial dressing. B. Notify the healthcare provider. C. Document findings only. D. Perform a wet-to-dry dressing change. Answer: B. Notify the healthcare provider. Question 15. A UAP is preparing to assist with oral care for a patient on neutropenic precautions. What instruction should the nurse provide? A. Use sterile gloves for care. B. Wear a surgical mask. C. Wash hands before and after care. D. Use tap water to rinse the mouth. Answer: C. Wash hands before and after care. Question 16. The nurse is teaching about infection control to visitors. Which statement requires correction? A. We will wash our hands before entering the room. B. We can sit on the patient's bed to visit. C. We will wear gowns and gloves when required. D. We will avoid visiting if we feel sick. Answer: B. We can sit on the patient's bed to visit. Question 17. A nurse preparing to suction a tracheostomy should wear which PPE? A. Gloves and gown. B. Gloves and N95 mask. C. Gloves, gown, and face shield. D. Gloves only. Answer: C. Gloves, gown, and face shield. Question 18. Which action by the nurse demonstrates proper use of isolation precautions? A. Removing PPE before leaving the room. B. Wearing a mask when entering any patient room. C. Removing gloves before the gown. D. Disposing PPE in a common hallway trash bin. Answer: A. Removing PPE before leaving the room. Question 19. When is double bagging of contaminated linens required? A. When linens are visibly soiled with body fluids. B. When the patient is in isolation. C. When transporting linens down a public hallway. D. When linens are lightly soiled. Answer: A. When linens are visibly soiled with body fluids. Question 20. A nurse is teaching a patient with C. difficile about preventing transmission at home. Which statement is correct? A. I should use hand sanitizer after using the bathroom. B. I can share towels if washed regularly. C. I will wash my hands with soap and water after toileting. D. I only need to wash my hands if there is visible soil. Answer: C. I will wash my hands with soap and water after toileting. Question 21. Which item requires sterilization before use on a patient? A. Blood pressure cuff. B. Surgical instrument. C. Bedside commode. D. Over bed table. Answer: B. Surgical instrument. Question 22. A nurse is observing hand hygiene practices. Which action requires correction? A. Washing hands after glove removal. B. Using soap and water after C. Difficile care. C. Rubbing alcohol-based sanitizer until dry. D. Shaking hands dry after washing. Answer: D. Shaking hands dry after washing. Question 23. When transporting a patient in airborne precautions, the nurse should ensure the patient wears which item? A. Gown. B. N95 respirator. C. Surgical mask. D. Face shield. Answer: C. Surgical mask. Question 24. What is the nurse's best action when a surgical mask becomes wet during patient care? A. Dry the mask and continue wearing it. B. Continue using the mask until care is finished. C. Replace the mask immediately. D. Cover the mask with a face shield. Answer: C. Replace the mask immediately. Question 25. For a patient with rubella, which transmission-based precaution is appropriate? A. Airborne precautions. B. Contact precautions. C. Droplet precautions. D. Protective isolation. Answer: C. Droplet precautions. Question 26. The nurse notes a colleague removing PPE in the following order: gloves, mask, gown. What is the correct response? A. Continue without correction. B. Remind to remove gown before the mask. C. Remind to remove mask first. D. Remind to remove gown before gloves. Answer: B. Remind to remove gown before the mask. Question 27. Which practice increases the risk of a catheter-related bloodstream infection? A. Scrubbing catheter ports before access. B. Using sterile gloves for insertion. C. Changing dressings weekly. D. Securing the catheter to prevent movement. Answer: C. Changing dressings weekly. Question 28. When caring for a patient on neutropenic precautions, what items should be avoided? A. Bottled water. B. Fresh cut flowers. C. Cooked vegetables. D. Packaged snacks. Answer: B. Fresh cut flowers. Question 29. A patient is admitted with possible meningitis. What is the nurse's priority action? A. Initiate droplet precautions. B. Begin contact precautions. C. Prepare for neutropenic isolation. D. Begin protective isolation. Answer: A. Initiate droplet precautions. Question 30. A nurse preparing a sterile field should first ensure which condition? A. Adequate room lighting. B. The room is free of visitors. C. The work surface is clean and dry. D. A gown is donned first. Answer: C. The work surface is clean and dry. Question 31. A patient with hepatitis B has blood on their linens. How should the nurse handle this linen? A. Place in a regular laundry hamper. B. Place in a yellow biohazard bag. C. Wash separately with detergent only. D. Spray with alcohol before washing. Answer: B. Place in a yellow biohazard bag. Question 32. What is the priority action after accidental splash of blood to the eyes? A. Report to infection control. B. Flush eyes with water for 15 minutes. C. Administer prophylactic antivirals. D. Wear goggles next time. Answer: B. Flush eyes with water for 15 minutes. Question 33. Which action prevents cross-contamination when using multi-dose medication vials? A. Using a new needle and syringe for each entry. B. Wiping the vial with water before use. C. Using the same needle if the vial is not empty. D. Storing the vial without a cap. Answer: A. Using a new needle and syringe for each entry. Question 34. What is the best method to prevent fungal infections in hospitalized patients? A. Use of prophylactic antifungals. B. Reducing humidity in patient rooms. C. Proper cleaning of equipment and surfaces. D. Wearing N95 masks for all patient care. Answer: C. Proper cleaning of equipment and surfaces. Question 35. A nurse caring for a patient with scabies should wear which PPE? A. Gloves and mask. B. Gown and gloves. C. Mask and goggles. D. Gown and N95 respirator. Answer: B. Gown and gloves. Question 36. A patient with VRE is being discharged. What home care teaching should be provided? A. No special precautions are needed at home. B. Practice meticulous hand hygiene. C. Visitors must wear gowns and gloves. D. Clean the entire home with bleach. Answer: B. Practice meticulous hand hygiene. Question 37. A nurse notes a UAP failed to perform hand hygiene after glove removal. What is the best action? A. Report the UAP to the manager. B. Provide immediate feedback and education. C. Ignore as gloves provide protection. D. Reassign the UAP to a different task. Answer. B. Provide immediate feedback and education. Question 38. What should the nurse do first when a sterile object touches a non-sterile surface? A. Wipe the object with alcohol. B. Continue using the object quickly. C. Replace the object with a new sterile one. D. Rinse with sterile water. Answer. C. Replace the object with a new sterile one. Question 39. Which technique minimizes contamination risk when opening a sterile package? A. Open the flap away from the body first. B. Open the flap closest to the body first. C. Use clean gloves to open the package. D. Tear open a package from the center. Answer. A. Open the flap away from the body first. Question 40. What is the priority nursing action if a patient's surgical wound is exposed to an unsterile field? A. Document the exposure. B. Apply an antimicrobial ointment. C. Notify the surgeon. D. Clean the wound with alcohol. Answer. C. Notify the surgeon. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.